We now join our outside broadcast crew for a live telecast. Please stay tuned.
Health, Dr. T.E.A.C.H, the representative of the Permanent Secretary, Federal Ministry of Health, the Chief Convener of these Event and Executive Director, National Primary Healthcare Development Agency, Dr. T.E.A.C.H, our very highly ever supportive development partners. We have here WHO, UNICEF, AFNET, and a host of others, either present or represented. Heads of ministries, agencies, and departments of government here, Center for Disease Control, NAFDAC, National Orientation Agency, and other agencies of government present or represented. Relevant stakeholders, heads of traditional institutions across Nigeria, representative of civil society organizations, NGOs et al., members of the fourth estate of the realm, distinguished invited guests, ladies and gentlemen. The National Primary Healthcare Development Agency, under the very visionary, vibrant, pragmatic, and dynamic Executive Director, Dr. T.E.A.C.H, has developed an indigenous strategy put in place to ensure the effective delivery of a COVID-19 vaccine to eligible Nigerians nationwide as the country awaits the receipt of the COVID-19 vaccines tomorrow, all things being equal. The strategy put in place by the National Primary Healthcare Development Agency is known as T.E.A.C.H. The agency is also leveraging on the experience of the COVID pandemic to introduce electronic management of immunization data, EMID, systems in Nigeria. All these are the initiatives of the National Primary Healthcare Development Agency that our Honorable Minister of Health, Dr. T.E.A.C.H, is set to launch this morning. And so, ladies and gentlemen, I welcome you most profoundly to the formal launch of T.E.A.C.H and EMID. But just very quickly before we get started in earnest, permit me to recognize Dr. Ngozi Azodu. She is the Director, Health, Planning, Research, and Statistics, Federal Ministry of Health, and she's standing in for the Permanent Secretary, Dr. A.M. Abdullahi. Let's please welcome her in that capacity, please. Without much ado, Your Excellency, very distinguished ladies and gentlemen, our special guest of honor, the Honorable Minister, would like to invite to the rostrum for his formal welcome remarks, Dr. Basi Okposen, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Dr. Okposen, please.
The Honorable Minister of Health, Dr. Ihanire, representative of the PS, Executive Director NPHCDA, Dr. T.E.A.C.H, DG NAFDAC, and representative of the NCDC, DG, our country rep, WHO, representative of the country rep, UNICEF, and all the directors from the ministry that are here and all our partners that are here. Please permit me to stand on other existing protocol. Our ministers are ED, partners, colleagues that are here. Today, I'm happy. The entire technical working group is happy. The ED, to see a beautiful day like this, we all the way when the pandemic started last year, the pains it has caused so many people, and the effort of His Excellency the President, the PTA, the Minister, who has played a fatherly role to support the work of the agency under the leadership of Dr. T.E.A.C.H, for us to start planning for vaccination of eligible Nigerians. A lot of work has gone in the technical working group chaired by the Executive Director, Dr. Faisal, for us to ensure successful vaccination in Nigeria. Today, I said it's a very happy day because we are seeing is gradually becoming a reality. We've been planning. Some say no action, but today we are beginning to see it happen. And on this special day, we also have in this occasion with us the minister physically present and all chief executive and all our partners, PS, everybody is here to roll it out. On behalf of the entire team, we want to say welcome to everybody, and we wish us all a very successful launching of this special, innovative, indigenous strategy to vaccinate Nigerians called the T.E.A.C.H strategy. And we're also going today to launch the electronic management of the immunization data system in Nigeria. Thank you all for coming. I wish everyone a blessed day and a successful day at this launch. Thank you.
Can we please give him another resounding applause for the welcome remarks? So very well delivered. We'll move on with the speed of light because time is of the essence, and I must also inform us that this program is being televised live by the largest television network in Africa, the NTA. So we're live on NTA as we speak. The Honourable Minister, permit me to stand on the existing protocol at this point as we invite the country director for WHO to please come over to the podium for his goodwill message on behalf of all other development partners. Dr. Mulumbo, please. A round of applause for him.
And on behalf of other development partners, I wish to congratulate the Honorable Minister of Health, the NPACDA, and the government of Nigeria for this important milestone. It's just 1 year since we commemorated, not celebrated. We commemorated 1 year since the first case of COVID-19 was detected in Nigeria. Ever since, we had more than 150,000 cases, but sadly, we lost close to 2,000 of our community to this deadly pandemic. But beyond that, and it has now been recognized, Nigeria has led an exemplary response to COVID-19. Nigeria has averted the catastrophe that was predicted by several models. And this is because Nigeria was among the first ones to show how political leadership can translate into result. The first COVID-19 case hit Nigeria, find Nigeria with a strong background of preparedness. Ever since, Nigeria has refined its intervention strategies, adapting to WHO guidance. And one of those is the vaccination, now that new vaccines have been endorsed by WHO for emergency use list. It's really pleasant to witness the launch of the T.E.A.C.H strategy just ahead of Nigeria receiving its first batch of AstraZeneca vaccine. This new strategy, the T.E.A.C.H strategy, will really help to ensure the governance mechanism, the accountability, the coordination, security, and ethics around the vaccine are followed through. The tool will ensure that Nigeria uses the best innovative strategies to track the introduction, the vaccination of the community wherever they are. It's really commendable, and I would like to assure the Honorable Minister of Health, the NPSCDA, ED, the entire government of our availability to continue to support the government, the community, the stakeholders, and all those who will be engaged in this exercise. It was rightly said, this year is about COVID-19 vaccine. But I would like to emphasize that vaccine alone will not do it. We will need to continue to adhere to public health and social measures until such time that we reach enough coverage to generate herd immunity. Congratulations again, Honorable Minister. Congratulations, ED, NPSCDA, the UN system as a whole, but also the other development partners will stand by and support and provide any additional support that may be required by the government of Nigeria to ensure that everyone that needs the vaccine receive it. I thank you.
Thank you very much, Dr. Walter Mulumbo, Country Representative for WHO, speaking on behalf of all other development partners, and has paid glowing tributes to the Nigerian government and, of course, the Honorable Minister of Health and the Executive Director, National Primary Healthcare Development Agency. I'd like us to please applaud him one more time. Moving on, we'll take two more goodwill messages, and the very first is going to be coming from the Director General, Nigerian Center for Disease Control, Dr. T.E.A.C.H, who is here represented by Dr. Priscilla Ibekwe, Director Special Duties. There's a warm round of applause for her as she comes up. You may also wish to stand on the existing protocol so we can move with the speed of light. Thank you so very much.
Been done in the past 1 year. You recall that on the 27th of February 2020, we recorded our first case. And healthcare workers, Nigerians together, have done a fantastic work of trying to reduce the casualty in the country. Over 1.5 million tests have been done. We have recorded about 155,000 cases, nearly 2,000 deaths, and a lot of casualties, and we do know the impact. And so we are very delighted to be at this meeting, at this launch today. We're very delighted to be here because vaccine is the way to go so that we can reduce the impact of COVID-19 on the population and on the world, because together we will defeat it. So we're very happy to be here and we'll continue to support. We're very grateful for the work that is being done by the primary healthcare the National Primary Healthcare Development Agency, and that we're here to support the whole process. Thank you very much.
Thank you very much, Ma. I'd like to then invite very quickly the Director General NAFDAC, Professor Pharmacist Mojisola Adeyeye. Please a warm round of applause for her, please, as she comes forward.
For NAFDAC, it started April 2020 to get ready for when the vaccines will arrive. We approved these vaccines on the 18th of February after a very arduous task, but our work started around that time too, because T.E.A.C.H and NAFDAC have been working round the clock to ensure that the vaccines arrive safely. We have to give an exemption to the arrival of the vaccines because we put a gateway to drugs coming from Southeast Asia to avoid substandard falsified medicines. So we have to give a special exemption for these vaccines because we want to be sure that the vaccines or drugs that are coming to our country have quality. I want to congratulate Dr. Faiza Shoaib for the hard work, but more importantly for our Minister of Health, our Honorable Minister of Health, for the guidance. It has been a rough ride, but we are here today, and our work just started. Our work just started because we're going to do track and trace of all these vaccines that are coming in to ensure there is no falsification during the supply chain. We're going to do pharmacovigilance to make sure that we monitor any side effect that could happen to the individualized patients. So we want to say thank you again for coming, and I want to congratulate Dr. Faiza and WHO. WHO is the one that is actually giving us the green light. So everybody on the high table are commended. Thank you so much, and God bless.
Thank you very much indeed, Director General NAFDAC. At this point in time, I'd like us to please sit back and watch some video and infographics that will be displayed on the screens right in front of you.
Da cewa wannan rigakafin me yasa a cikin lokaci kalilan aka fara ta amma an gama ta bayan sauran rigakafi kuma suka yin shekaru waɗansu ma shekara 10 waɗansu shekara 15. To abinda kullum muke ba mutane amsa cewa kullun shi ilimi na harkar lafiya kullun ci gaba ake samu. Yanzu ci gaban da aka samu ba muna fatan nan da shekara 1 shekara 2 ko 10 a samu ci gaban da yafi waɗannan ma. Ai kullun ci gaba ake bincike ake kamar yadda yake a kowane bangare na rayuwa kullun ci gaba ake samu. Yanzu ka dauki abin hawa na shekara 20 ko 10 30 da yanzu ai ba zai zama ɗaya ba. Kullun ci gaba ake. Wani zaka da a ce yana shekara guda kafin ya kai wani wuri a yau kuma sai ga yan ci a kwana ɗaya ko a wuri ya kai wurin ko ba haka bane. To haka yake ci gaba aka samu a yadda ake samu a yi rigakafi da wuri. Ita wannan rigakafi musamman wanda muke kiranta mRNA akwai ci gaba na kimiyya wadda ake yin ta a cikin kwalabe na dakunan bincike. So ba sa dadewa kamar waɗansu rigakafi wanda za a yi allura a jikin dabbobi kuma su fito da waɗannan dakarun yaƙi na antibodies. A'a wannan bangaren da aka yi amfani da shi da wani abu da muke kiransa DNA template shi ake amfani da shi a laboratory a cikin ɗakin bincike ba ƙwararru sannan su taimaka a yi waɗannan alluran. Sannan kuma dalili na biyu kuma mutane suna cewa an gaggawa.
Fact, pregnant women should be among the groups, just like healthcare workers, that should be given the vaccine, because it has been shown that pregnant women that were infected, they had abortion. It affected them adversely in studies in Italy and US. And then people that will take these vaccines are those that are vulnerable. Those that, because if you find out many people that have diabetes, that have high blood pressures, they are the group that should take this vaccine first, and then the healthcare workers. These are the ones that should be giving this vaccine.
How about children?
Children, for now, should not be given
should
because
be left
they are,
out.
yeah, for now. Usually it's like they are in between until finally, because they are in the first stage. The first stage, until finally they've done the final safety check.
For now, we don't have any evidence for that because the tests that were done, the trials that were done, did not include pregnant women and lactating mothers. So we cannot tell you how it is going to react in them. However, if you go by the things of the past, I'll give you an example. In 1985, 86, around that time, we had this huge epidemic of yellow fever in Nigeria. And we vaccinated everybody. At that time, inadvertently, a lot of pregnant women were also immunized against that virus. But then we followed them up for 3-4 years, and there was nothing untoward that happened to them. So ideally, there shouldn't be any reason why we should have that. But then you are taking precaution. Until you test it, you cannot be sure what is going to happen. In dealing with pregnant women, ordinarily when there's no epidemic, you don't want to give it to them because again, you don't know what is going to happen to the fetus. But in an epidemic, when the mother is also exposed to that disease, what you want to do, you should protect her because you don't know whether, because if she gets sick and she dies, the fetus will also die. And therefore, you give the vaccine during a raging epidemic to the women, and you hope that even if the baby does not survive, the mother.
Thank you very much. Please can we put our hands together for National Primary Healthcare Development Agency, the ED, CEO, and all the lieutenants. Please let's give them another resounding applause, please, for a yeoman's job that they are doing. Moving on, the Honorable Minister, permit me to please stand on the existing protocols as we move on. It is time to get the man at the helm of affair of the National Primary Healthcare Development Agency, the Executive Director and Chief Executive Officer, Dr. Faisal Shuaib, to come and introduce to us T.E.A.C.H strategy for COVID-19 vaccination and demonstration of the electronic registration EMID. Ladies and gentlemen, please, let's give him a deserving round of applause as he comes forward.
Your Excellency, WHO country representative, my colleagues, the DG of NAFDAC, the DG of the NCDC, ably represented by Dr. Priscilla. I want to recognize my sisters, the Director of Health Planning, Research and Statistics at the Federal Ministry of Health, Dr. Ngozi Azodo, who is here representing the Permanent Secretary of the Ministry of Health, the Director of Family Health, Dr. Salma Anas Kolum, who is here providing support to all of the amazing work that the staff and management of National Primary Healthcare Development Agency and our beloved donors and partners are doing. Today we'll be sharing with all Nigerians an indigenous approach to the rollout of COVID-19 vaccines in Nigeria. This approach was developed under the able leadership of the Presidential Task Force on COVID-19 and the direct day-to-day leadership of the Honorable Minister of Health. Can we give him a round of applause, please? This approach wouldn't have been possible without the leadership of the Honorable Minister providing us with an environment to flourish, an environment to reach out into the future and roll out technological advances. I want to seize this opportunity to appreciate our partners for all of the support that made this possible. At NPHCDA, we always want to innovate. We've leveraged all of our experiences from eradicating the white polio virus in Nigeria to roll out COVID-19, working with the governors, the states, and the local government areas. We feel that with the collaboration that exists between the national and the sub-national level, we'll be able to roll out these vaccines in a way that will be testament to the resources, both human and material, that exist within the Nigerian polity. I want to seize this opportunity to also appreciate the private sector coalition known as CACOVID for their support towards making sure we're able to roll out this improvement in our technological approaches to the rollout of vaccines. What we have done with the T.E.A.C.H strategy is really to combine the first world approaches with our context in terms of our experiences with campaigns. You will recognize that when the developed countries started rolling out the COVID-19 vaccinations, they experienced some hitches just because their system is more routinized. They are not as used to campaigns like we have. In the last 10, 20 years, we've had an average of 6 to 8 campaigns every year. Now that experience is what we're bringing to bear. And that experience is what we're combining with the experiences that we've seen from developed countries to roll out a unique strategy for Nigerians. So today, it is my honor and a privilege to roll out the T.E.A.C.H strategy, which is a strategy that stands for where T stands for traditional vaccination approach. So I'll just go down to the I'll just go down there so that we can have more conversation. Where is the microphone? Yes. So what we have here is T. T stands for the traditional approach to vaccination. That is to say, we're going to be rolling out COVID-19 vaccines the way we were used to rolling out campaigns in the past. So whether there are yellow fever campaigns, measles campaigns for kids, meningitis campaigns for adults, we're going to be making sure that in every political ward that there is one primary healthcare center that will have the vaccines, so that in the most closest health facility to Nigerians will be able to walk across and have the vaccines. But apart from that, we will also have what we call the temporary fixed post. That is to say, we will have teams move from one settlement to another. We'll also have mobile teams. The mobile teams will be responsible for making sure that no matter where you live in Nigeria, there will be a team that will come to a neighborhood near you. So whether you live in a riverine area, you live in a place that's in the desert, we will find a mobile team that will come as close as possible to where you live and work. So that is the T for the traditional system. In the traditional system as well, there will be an opportunity to register all clients that come for the vaccine. E stands for electronic self-registration by eligible Nigerians. What this means is that following the launch of this strategy by the Honorable Minister of Health, we will be sharing with you a link where every Nigerian will be able to click on this link and personally register their details. This link will contain, for example, whether you are a health worker or not, what is your occupation. For those who are health workers, those who are frontline health workers, these are the people that we are going to be prioritizing to vaccinate in the next few days. If you are not a health worker, it will also provide you with an information around when you are likely to have your vaccines. So the link that will be shared is for self-registration. But we also know that we live in a country where not everybody has access to a phone, not everybody is educated enough to click on a link and fill out the forms. This is where we have the assisted electronic registration. So, for example, in a local government, if there's any health worker who is not able to do this self-registration, there will be designated individuals who will support the registration process. Furthermore, when you come to a designated fixed post, a designated health facility, whether it is a primary healthcare center or a general hospital or indeed a tertiary health facility, you will also have the opportunity of being registered. So all of your details will be collected and you will have a unique identifier at the end of the day so that we'll be able to link the vaccines with the individual. The next letter, C, stands for concomitant vaccination alongside electronic registration. That is to say, when people come to any site to be vaccinated, they will have the opportunity of being registered and getting the vaccination at the same time. So we do not want to roll out just an electronic system, but also a manual system for those who live in rural areas where there might be challenges with the internet or even the ability to register. The last letter, H, is another attempt to make sure that no Nigerian is left behind as we roll out the T.E.A.C.H strategy. The H stands for house-to-house registration. That is to say, if you're not able to self-register, we are going to be able to identify those areas where challenges exist with registration. That is to say, we will have maybe a dot map that shows where we've been able to capture people that have self-registered, have been assisted with registration, and we will now deploy teams to go to those areas where the self-registration, the assisted registration is suboptimal. So we've been able to look at this type of approach to make sure that we're able to reach Nigerians with the vaccines as soon as possible, and that those vulnerable people, those people in the rural areas who typically are left behind, are not neglected when it comes to their access to the COVID-19 vaccine. I will now describe exactly how we're going to be rolling out the vaccines. There have been a lot of questions around who is eligible. Are you going to be among the first people to take the vaccines? We've categorized the rollout of the vaccines into different phases. The first phase, phase 1, will focus really on frontline health workers. So those people who are taking care of the sick, people who have COVID-19. In the last 1 year, these health workers have sacrificed so much for the rest of us. And we believe that it is only morally right that they are the first people who are protected from contracting the virus. We've lost quite a number of health workers because of the work that they do. The first phase will also involve other frontline workers, people in the security, people who are first responders, and also strategic leadership. It is very, very important that our leaders also publicly demonstrate the safety of these vaccines by coming out to have themselves vaccinated. This is why among the strategic leaders who are going to be taking the vaccines are Mr. President himself, the Vice President, ministers, governors, traditional and religious leaders, because they want to emphasize that these vaccines are safe and they are effective as validated by NAFDAC. So if you do not fall into this category, then it means you are not likely to be among the people targeted in the first phase with the 4 million doses that are arriving in Nigeria tomorrow. The second phase will cover older adults aged 50 years and above, those who have comorbidities. So those people who have underlying disease but are aged between 18 to 50 years are in the second phase of the vaccination. The third phase will cover those with those LGAs and states with high burden of disease, and then the final phase is really around the rest of the population. As we go through the different phases, we have to be mindful that these are not necessarily discrete phases. There's a lot of flexibility, evolution that will be determined by our access to the vaccines. The 4 million doses that we're receiving tomorrow is just the first batch of the 16 million doses of vaccines of the AstraZeneca vaccine that will be coming free of charge through the COVAX facility. Now, the question is, where do we go from here? Now we understand the strategy that we're going to use to deploy the vaccines. Now we understand the different phases and how we have categorized Nigerians so that everybody understands where they fall and when they are likely to get the vaccines. Of course, on a regular basis, we're going to be updating Nigerians as soon as the vaccines come and what category of individuals will be eligible. For the self-registration, when you go to the website of the National Primary Healthcare Development Agency, you will see a link. So what this slide is showing is the link to the vaccination, the e-registration that provides you with the opportunity to register. So this, again, is the NPHCDA website. This information is also available on our Facebook, on our Twitter, and Instagram pages. So we'll just click on that link right there, and this is what it brings you to. This is the link. Can you back up so that people can read the link? So this is the link for registration. So if you can copy it onto your browser, we can do this registration while we're here. So it disappeared. Yeah, can you back up so people can copy it? I want to be sure that everybody has it. So it's mpacdaict.com.ng/public-reg. PUBLICREG. So you can put this on your browser, and this will pull up the e-registration form. I think everybody has this by now. So we can move on to the form. So when you pull up the form, this is the first message that you will get. The Electronic Management of Immunization Data Registration Portal. This is a registration platform of the Federal Ministry of Health for COVID-19 vaccination. It captures your data, it schedules you for COVID-19 registration. So once you're able to register here, you'll be able to get your registration at a facility that is close to you. Yeah, so right here, you will see different fields, your name, starting from the last name, the first name, and your middle name. For all of those fields that have the red asterisks, those are mandatory fields that you will need to fill out, otherwise you will not be able to move to submit your form. So next is your contact phone number. The provision is such that you have to enter your phone number twice so that we are sure that you do not make a mistake. Because sometimes you might fill in a number and then you make an error. But when you do it twice and those numbers are identical, then it is possible to move ahead. So you will now fill in all of your other details, such as your contact address, your email address. You will also have, it also asks whether you know your exact date of birth. If you know your exact date of birth, you click yes, and then there will be a drop-down menu that takes you through the exact day, month, and the year. If you say no, if you click on no, it gives you the opportunity to provide an estimate of what your age is. So moving on, it provides you an opportunity to let us know what your gender is. Let's say you click that you are male. It now asks you what kind of ID you have. There's a drop-down menu that allows you to click what type of ID you have. This ID will be expected when you come for your vaccination, but we also recognize that there are people who do not have an ID. If you do not have an ID, for example, some of the people who live in the rural areas, you just click that it is not available. It does not preclude you from going ahead to register. Then the next field asks about your residential address, and then what states. We say the FCT, for example, the local government, in this case, of course, what area council, and then which ward. Again, what we're trying to do is to try and locate you so that if for any reason you take the first dose of the vaccine and you default on the second dose, then health workers will be able to track you and make sure that you get the second dose so that you can get full immunity. Moving further down, you also have the opportunity, after filling out this field, to select the closest vaccination center to where you live. So when you say, for example, you live within the city center ward in the FCT, then a drop-down menu provides where you can easily get vaccinated. So for example, we've chosen the National Hospital, Abuja. Then you also have an opportunity to choose the day and the time that you will want to come for your vaccination. Again, we don't want to repeat the situation that we found quite recently when people went to go and do registrations and, you know, they were not able to observe the IPC protocols. You know, there were large queues and there was a lot of frustration. But if we're able to schedule when you go, then we will do it in such a way that people are able to come and be organized in the way they get their vaccines. So so you also have whether you want an early morning session, an afternoon, or an evening session. Moving on, we also ask questions about whether, okay, so the next field actually asks you to take your photo. Now, this is an opportunity for us to have information in the database that makes sure that when you come for the vaccination, we can validate that people will not come and say they are yourself when in actual fact they are not. And then if in the event of an adverse reaction, we're able to make sure that you are the one. And we're also able to link this up in case we do decide that we will need this type of identification for travels. As it were, by the time you get your vaccination, there's a seal that will have a QR code that will be linked to this data. So anytime that QR code is used, it pulls up your data and your identification becomes obvious. So the next field asks whether you work in the health sector. You say yes, but even if you work in the health sector, we are trying to prioritize those who work in the front lines. So it provides an opportunity to select that you probably work in the COVID-19 treatment center, and that is what you select. If you're not in the health sector as well, you know, if you're in the health sector but not in the front, you're not a frontline worker, then that opportunity is there. So another important use of this electronic registration is that it gives us an opportunity to prioritize those that have underlying disease. You recall that I mentioned that those that have comorbidities or underlying diseases are going to be prioritized. Now, this field provides us with an opportunity to identify those. So there is a list of underlying conditions that tends to potentiate the severity of COVID-19 infection. So if you have any underlying disease, you click on that, and that automatically moves you up the ladder of people who will be vaccinated, so you will be prioritized. Then if you have any allergies, yes or no. So we have about 14 questions. We've assessed that this will take you about 5 to 6 minutes to fill out. So every form should take you between 5 to 6 minutes. We've also set it up in a way that it provides Nigerians an opportunity to rapidly fill this form in a way that is user-friendly, but also does not deny anybody the opportunity of being vaccinated, right? We also recognize that the network might be very poor in some areas. That is why we're not making any field that, for example, taking of photos mandatory, right? We would like it, we'd like to have it, but if you are not able to do it, then we know that there's another opportunity when you come for vaccination to do all of that. So we've come to the end of the filling the form. You will now hit submit. So when you hit the submit button, there's a pop-up that reminds you that you are both about to upload your record to the server, after which you will not be able to make changes. So it confirms whether you really want to submit. So we hit yes, we want to. Then it asks you to ensure that you save your vaccination ID, which will be issued in the next page. So the unique identifier, once you fill the form, nobody else in Nigeria will have this unique identifier. It's your pre-vaccination identifier that you will take along with you when you go for the vaccination. When you go to the site for vaccination, on the next page, you will have that unique identifier that you must keep very close. Click, and here you are. So your vaccination ID is this, right? Your data has been successfully captured. Then you will get an SMS and an email shortly that tells you where you are going to get your vaccination, when you are going to get it, and what time. So it also asks you if there's another form you want to fill for somebody in case you are going to do assisted registration for somebody else. That is the button right there. Do you want to assist another person? Then if you click yes, then it pulls up another fresh form. So for example, if you are in a community where you are the only one who is literate, then you are able to, get people together and help them vaccinate. So once you click on that, we are back to a fresh form. Is there anybody who followed us and was able to fill up? Yes? Did you get a text message? Can we give her a round of applause? So what does it say? You have your ID, okay. Can you check your SMS? If you use your correct phone number, you should be able to get a message that tells you you have successfully registered and you should get your vaccination site is X, your date of vaccination and the time should be provided. So you should be getting you should be getting it shortly. Did you get yours? Okay, excellent. Can you give, yes? Did you get yours? Can you read what you have?
Dear T.E.A.C.H, which was the name you saw we imputed during the demonstration, you have successfully registered and scheduled for the first dose of COVID-19 vaccine at National Hospital, Abuja on the 5th March 2021 and the early session 8 a.m., in between 8 a.m. and 10 a.m. Your vaccination ID is NGFC, the long number we saw on the screen, QH.
Oh, thank you very much. Okay, thank you very much. Did you get yours? Okay. Can you tell us? Yeah, you can come. So this is somebody from the audience. Can you show us? Yes. Can you tell us what you have seen?
Oshinda Inde Ademilayo, you have successfully registered and scheduled for the first dose of COVID-19 vaccine at FCT Abuja Sheraton and Towers Hotel on the 12th of March, time 10 a.m. to 12 a.m. Vaccination ID FC 2077872 QB.
Excellent. Can we give her a round of applause? So, Honorable Minister, distinguished ladies and gentlemen, our hope is that when we roll out the vaccination process later this week, starting from the treatment center at the National Hospital, that health workers will be able to register even ahead of that launch. Then we will now consider strategic leaders and identify specific health facilities where these vaccines will be rolled out. While we're excited about the launch of this T.E.A.C.H strategy, a very, very important aspect of the T.E.A.C.H strategy is the fact that it is futuristic. So here we are, we'll be able to, courtesy of the COVID-19 pandemic, we'll be able to get a database of all Nigerians who are being vaccinated, and we'll be able to follow up and make sure that they get both doses. We'll be able to schedule them so that we can do it in an organized way. But beyond that, we're going to transition this database to our routine immunization system. This is really what is amazing about this system. So that as we vaccinate our kids, we'll be able to make sure that we follow up with every child to make sure that they get each of the childhood vaccine preventable, all of the childhood vaccines that they need. And if for any reason any child is not able to come to the health facility, having them in a database like this provides the health worker with an opportunity to identify where they live and will be able to follow up with the parents of the child and make sure that the child gets vaccinated. Isn't that simply amazing? So this brings with us also a huge opportunity to do tracking and tracing of the vaccines. So as you go to take your vaccine, right from when the vaccines actually come, we'll be there with NAFDAC. My sister, the DJ of NAFDAC, is very excited about this tracking and tracing. Every 2-3 days, she said, okay, Dr. Faisal, I hope you have remembered that we're doing tracking and tracing. I said, yes, you told me that 2 days ago and then 4 days ago. So we've been having a lot of exciting conversations with the DJ NAFDAC around how we can use this opportunity to track every package of vaccine. So for every vaccine, for everybody who is taking a vaccine, when you come to the vaccination center, your record will be linked with the exact pack of vaccines that you are getting. So that, God forbid, if there's any adverse event, any reaction to the vaccine, we'll be able to link it to the exact package, the exact pack from where the vaccines came. And NAFDAC will be able to carry out an assessment. But we're also working with NAFDAC such that if there's any adverse event, there is a database where this adverse event is transmitted immediately to a server. We're also identifying sentinel sites where we will be collecting data about how Nigerians are taking these vaccines, and if for any reason there's any side effect, we're also documenting them and sharing with the global community. So I want to end today by really appreciating the Presidential Task Force, the leadership of the chairman of the Presidential Task Force, who made it possible for us to work collaboratively across different sectors to make this strategy available. I want to once again appreciate the Honorable Minister of Health, the directors from the Federal Ministry of Health, the management of MPH-CDM. But I also know from the communications between the Presidential Task Force on COVID-19 and His Excellency Mr. President, that Mr. President is always asking what the update is. When is the vaccine coming to Nigeria? So all of the efforts that you see coming together has been because Mr. President has personally showed commitment and interest in making sure that once vaccines are available, they come to Nigeria. So thank you very much, distinguished ladies and gentlemen. It has been an honor and a privilege to present this strategy on behalf of the partnership.
We can do better with that round of applause for the Executive Director and CEO, National Primary Healthcare Development Agency. Ladies and gentlemen, for me, this is the way to go. Please give them another round of applause, please. Thank you very much. We're moving on really very fast, and I'd like to just mention that a lot of people are online watching and participating as well, and we want to specifically recognize Dr. Hamidre Zah, the Senior Manager Nigeria for Gavi, the Global Vaccine Alliance. He's online as well. Let's please put our hands together for Dr. Hamidre Zah and all other persons watching online. Moving on, having listened to the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, and you have also heard from him the key role played by the Honorable Minister of Health, Federal Republic of Nigeria, Dr. T.E.A.C.H, Ehanire. If he did not give the kind of support and robust support he gave, it would have been pretty difficult for this to happen. And I think the Honorable Minister deserves a round of applause as well, please. And so moving on, I'd like to, at this juncture, invite, because I find it really very pertinent and expedient at this juncture, to then invite the Honorable Minister, Dr. T.E.A.C.H, Honorable Minister of Health, to please come forward for his keynote address and launching of the T.E.A.C.H strategy and the EMID. Ladies and gentlemen, please join me in welcoming the Honorable Minister to the podium. I can't hear that applause, it could come louder.
Dr. Faisal, the Director General of NAFDAC, Professor T.E.A.C.H, the representative of the Director of NCDC, Dr. Ibekwe, respected ladies and gentlemen, particularly of the press. In Nigeria, the COVID-19 pandemic has spread as rapidly throughout the country as it spread around the world, leaving footprints of an illness affecting the economy and the whole of society, with debilitating effect on some countries and systems. There is no doubt that these have been trying times for humanity, for all countries, and also for every Nigerian. Despite the challenges, there is now hope of relief with the introduction of the much awaited COVID-19 vaccine. Vaccination with safe and effective vaccines against COVID-19 is a critical part of Nigeria's strategy to counter the pandemic and stop transmission of the virus. To this end, several research bodies and pharmaceutical industries have responded to the call to develop a safe and efficacious vaccine against COVID-19, and it has yielded results in record time in various areas of the world. We in Nigeria finally have the privilege of being able to join other countries in kickstarting the immunization program, which will prioritize, first, those people most at risk of infection due to their exposure in the line of duty, those are the frontline health workers, and also those who, if they get infected, are at highest risk of severe disease. All these have been as determined by available epidemiological data. Our goal is to introduce the COVID-19 vaccine in a phased and equitable manner based on advice of the World Health Organization and the experience we have observed other countries to make, and ultimately vaccinating all eligible Nigerians within the next 2 years in order to ensure herd immunity. T.E.A.C.H, which is T.E.A.C.H, is an acronym for a 5-point strategy developed by the Vaccination Implementation Arm of the Federal Ministry of Health, which is the National Primary Healthcare Development Agency, out of its many, many years of vaccination implementation experience in Nigeria, and most recently, as has already been said, with the Polio Eradication Initiative. And that acronym translates as follows: T for Traditional Vaccination Campaign Approach, E for Electronic Self-Registration by Eligible Nigerians, A for Assisted Electronic Registration for Eligible Nigerians, C for Concomitant Vaccination alongside electronic registration, and H for house-to-house electronic registration. This is very well put together. And it is the launching of the T.E.A.C.H strategy for COVID-19 vaccination and electronic management of immunization data that we are here gathered to perform today as a very important activity to assure Nigerians of our readiness to roll out the COVID-19 vaccination campaign smoothly. I am delighted and privileged to be leading this event as Minister of Health at this time. I assure you that the world is inching closer to gaining control of this pandemic, and with all the emphasis Nigeria, the Ministry of Health, and N.P.A.C.D.A. have placed on the various pillars of our overall response strategy, from community engagement and risk communication, to improving COVID-19 case management, to maintaining routine and essential medical services, to providing more timely physical and eventually financial access to healthcare service during times of personal health emergency, so that we do not leave any Nigerian behind and we do not suffer decline in other areas of healthcare. And now to the access of all eligible Nigerians to COVID-19 vaccine administration. I again commend the National Primary Healthcare Development Agency under the leadership of Dr. Faisal Shuaib and his very hard-working team, who have developed a homegrown strategy to deliver this novel vaccine. The introduction of electronic management and immunization data is critical to addressing challenges we have with integrity and quality data, and ultimately primary healthcare data. Dr. Faisal has very elaborately described this to you and all the benefits that Nigeria will have from the past, and also the benefits that will help us in the future. I therefore urge all stakeholders, partners, subnational governments, corporate organizations to have faith for once in the plan that the government is developing and to align with the initiatives born of years of experience in the immunization space. No private hospital or organization has the experience with handling this type of novel vaccine, and certainly not the experience in vaccine application that N.P.A.C.D.A. has. All questions about the vaccine can be directed to the Ministry of Health and to N.P.A.C.D.A. But this is not a time to work at cross purposes. It is not a time to be making private or parallel arrangements for vaccine procurement and or vaccine administration. This will only disorganize what has been so carefully planned out and create chaos. Vaccines that are not approved by NAFDAC will be determined as dangerous, and they will be seized by customs and NAFDAC, who are on high alert for illegal vaccine importation. Fake and falsified substandard vaccines are already around in the global illegal market. The federal government is in a position to take care of all the interests of various segments of society and to handle all, I emphasize all requests and wishes from all areas. We have received requests from foreign embassies and international organizations to be included in the vaccination program, which will be professionally handled. We have also worked very closely with the private sector, and I here want to again join in appreciating the COVID, who have offered to support us, not only financially, but also with making the necessary contacts and access to all our desires in the health sector with regard to COVID-19 vaccine acquisition. Nigeria has opened an account with the Afrexim Bank, through which all procurement we make will be paid for. Any corporate organization that wants to support the government effort is invited to consider making that contribution to that account. Government does not need to receive your donation. The Ministry of Health does not need to receive it. NPACA does not need to receive it. The account is there for all those who want to support us. And as I have said, the interests of all organizations can be safely, easily, competently, and professionally accommodated by NPACDA strategy. In less than 24 hours from now, the first batch of AstraZeneca vaccines will arrive in Nigeria from the COVAX facility and will be deployed to vaccinate first, as I said earlier, the critical frontline health workers who are providing essential care, especially for the severe COVID-19 patients. Next are those who are at high risk of severe disease. Every health worker who gets infected, we have to go into isolation, and that means one more less staff. That is the reason why they are prioritized, because they are exposed. We want to be able to have covered 70% in order to achieve our desired herd immunity. The World Health Organization has advised all countries to limit vaccination for now to persons above 18 years of age until research and studies are completed on any possible effect on growing children of 18 years and below, except such children have severe underlying illnesses where the benefits of vaccination justify the risk. All countries are following this guideline and other global guidelines issued by global authorities, as Nigeria will also do. This is made all the more important by the fact that the target population for our vaccination exercise, we must remember, is not the usual cohort of children that we are used to, but this time adults. As a novel vaccine, NPACDA has trained vaccinators to be ready for the known and unknown side effects, which will be handled professionally and recorded for knowledge. And let me add here that the government has had to issue what you call an indemnification for these vaccines because they are new. And they should not be handled as if they are regular routine vaccines like tetanus vaccines or other vaccines. They need to be handled centrally, properly governed. As we have been told, T.E.A.C.H is a hybrid of our traditional vaccination campaign using the microplan and the electronic registration systems seen in advanced countries. The development of this hybrid is commendable, and I'm sure our immunization landscape will be much enhanced by the experience from this exercise. NPACDA will take advantage of the best available knowledge and skills in the world with regard to the unfolding COVID-19 vaccine space. I urge all eligible Nigerians to take advantage of the COVID-19 vaccination exercises when it is their turn. This is the only way we can achieve our target of herd immunity to stop community transmission of the virus. Well before the 4 million doses we are going to receive, the 4 million doses of AstraZeneca, well before it is expended, we shall be receiving more vaccines. So there should be no need for anxiety. We shall also be receiving other types of vaccines. And all this will ensure that the entire vaccination administration will be sustained in a smooth way and also will be applied nationwide. No one will be left out, no one will be left behind. I want to thank all our partners who have been working very hard with T.E.A.C.H under the auspices of the COVID-19 Technical Working Group and also the COVID-19 Vaccine Coordination Committee. I urge you all not to rest on your oars until we complete this exercise, which should last 2 years, but which within the next month or two, we go through the initial phase of learning and adaptation of the plans to reality. I am not ruling out the fact that there may be a hitch here and there, but this hitch will not arise as a result of not having tried. There will probably be hitches due to the unknown and unforeseen. But sooner or later, we have a routine, smooth, operational system for the vaccine administration. So we'd like to also here ask that you show understanding if there are any initial unavoidable hitches, as we have seen in every other country in the world, and I have constantly drawn the attention of T.E.A.C.H for us to sit down and look at any imaginable gap in our system. And I can say quite clearly that they have responded very well and tried to cover all the gaps that we can see. But since man is not perfect, it's possible that there are still one or two little gaps which will be addressed immediately as they appear. Here, I want to acknowledge and appreciate the critical role the media has played in supporting government in this exercise. Your role is extremely important in passing on accurate information and supportive information, and also in not participating or propagating fake news, false rumors, disinformation and misinformation that can crop up anywhere. Distinguished ladies and gentlemen, it is my honor and privilege now to hereby officially launch the T.E.A.C.H strategy for COVID-19 vaccination and the electronic management of immunization data system in Nigeria for the health of our people and to the glory of God. Thank you for your attention.
Just before he gets to his seat, the Honorable Minister deserves yet another round of applause. Thank you very much. Please be seated. Well, thank you very much indeed for launching the T.E.A.C.H and EMID strategies for vaccination and immunization respectively. Moving on very quickly, distinguished ladies and gentlemen, the next on our agenda is quick interventions from all of you. Questions, and there will be answers. So if you intend to ask a question, please can we get the other microphone ready? If you intend to ask any question, just please indicate by the raise of hand, and we'll bring the microphone to you. And then the persons on this side of a divide will be putting pen to paper so they can take your questions adequately and response will be given as well. So do we have questions coming, especially from my colleagues of the Pen Force of Nigeria, journalists? Do we have questions? Yes, there's a gentleman there. Please, what you do is, the moment the microphone gets to you, introduce yourself and the medium you represent, or organization you represent, and then you can ask your questions. But please go straight to the point and keep them brief for better understanding. Please, your question. Turn on the mic, please.
My name is Friday. I work for Channels TV. I would like to seek clarification from the minister. I didn't get better understanding of what he meant by indemnification of the vaccines. Does it mean there will be compensation for people who perhaps are adversely affected in the course of vaccination? I just need more clarification on that. Then the ED, National Primary Healthcare Development Agency. I'd like you to address the concern about how you will ensure that these vaccines, not particularly the AstraZeneca vaccine, because we've been told that it doesn't require those extreme cold temperature. But we know that there are other vaccines coming apart from AstraZeneca. So the concern about how we ensure that these vaccines are kept in the required temperature as we move them from one place to another. I'd like you to address that concern. Thank you.
Thank you. Any other question? Yes, please. The man behind him, or beside him, so to speak.
Good afternoon, Honorable Minister, sir, and the Executive Director, National Primary Healthcare Development Agency. Kenneth Eze from Speak Out Africa Initiative. My question is in twofold. One is, do we have a checking method put in place to make sure that Nigerians are not being taken advantage of in terms of monetary exchange? I ask this because in some other previous government initiatives, which are meant to be free, we hear of people taking advantage in the rural areas. And so, is there a measure put on ground to make sure that we're not going to get any report of any exchange for anything in terms of money to do people in the village who are not privy to this information? And the second part of the question is that we know that the task of advocacy for this goes to the DG, Executive Director of National Primary Healthcare, is such a very big task, which is not supposed to be left in the hand of the government alone. Like my organization and other organization, is there plans to involve the indigenous civil society organizations? Like my organization, we've made an expression towards that. Is there plans? Because we know the nook and crannies. I'm talking about not the professional handling, I'm talking about the advocacy. So that what is already being perceived, where people already entertaining fears and we know a lot of rumors, we can be able to counter it. Thank you.
Thank you. Any question, any further questions, please? Where are you? Okay, please just mention your name, the name of your organization, and then you can go ahead.
My name is Maureen Eke. I report for Radio Nigeria Network News. Good morning, Honorable Minister and the ED of Primary Health Care. All protocols duly observed. We all know that vaccination come with some kind of mild effects like fever, like headache and all that. But my worry is, in case some people come down with adverse reactions from this vaccination, from COVID vaccination, what happens? What will be the role of the federal government, primary health care, and relevant agencies to resolve it? Thank you.
Thank you. We have 3 questions thus far. Do we have any further questions? If not, we'll yield the microphone to this side of the divide for their response. And I think a question was directed at the Honorable Minister, the very first question, and I think would allow the Honorable Minister to respond to that real quickly. There's a microphone in front of you, sir. Honorable Minister, and after which we'll invite the ED to then respond to the other burning questions that were asked.
Yes, thank you for your questions. I hope I'm coming through. The question of, if I understand you correctly, compensation for adverse effects. Is that correct? Yes. This emphasizes the reason for a coordinated approach to this vaccination. The National Primary Healthcare Development Agency is a government-recognized agency for administering vaccines. In this case, we are dealing with a new vaccine. Its properties are not fully known. They are unfolding globally wherever they are being used. And we are also going to be observing very closely what the effects are. Now, governments have had to sign what you call an indemnification, which means that the producer will not be necessarily held responsible for whatever the effects are. Whether you get immunized or you do not have the immunogenicity. Thank you. If there are vaccines administered through correct government portals, vaccines with a recognized batch number, government will stand up for every treatment that follows it. You will not be charged for it. Government will make sure that you are nursed to good health because you gave that indemnification. Secondly is that the vaccine is free. Nobody is going to be asked to pay for it. But as I said during my speech, there are organizations that have asked to support government with donations. I can say clearly here that the Central Bank, and we thank them for that, the Dangote Foundation, we have spoken with, and the This Day organization, and even the BUA organization have offered to support government, but that support, if it has to be in a financial form, and go straight to an account that government has in Cairo with Afrexim Bank. That's the procurement organization. And whatever vaccine comes in is known, its batch number is known, is coming directly from the factory. So government will be able to stand for those and for their effects. But anything else coming otherwise will be impounded by NAFDAC and will not, because to be regarded as dangerous. We do not know the source. We know that there are many fake vaccines, substandard vaccines, and falsified vaccines already in circulation. We have been warned. So compensation means that government will be ready to cover the cost of handling any adverse effects. I believe that covers the third question that came in here. And you can imagine that if private people start administering these vaccines privately and effects happen, they're out of control. And therefore, you are at risk of being on your own if anything happens. And the government also will not have data of what you were given, who gave it, when, and what the reactions were. So we are going to here advise the public to stick directly with the advisory that NAFDAC has, that NPACD has given, and not to indulge in vaccines given around the corner or by the roadside. As for vaccines administered in rural areas, no charge is to be made. These are supposed to be free. If anybody is asking for money, make a report immediately, and those reports will be followed up very stringently, because the idea of government is to provide access to everybody at no cost to them. And if we are going to start charging money, it means that those who do not have the money will be left out, and we shall not achieve the herd immunity we are looking for to keep all of us safe from the vaccine. I hope these answer the questions that we are talking about.
The Executive Director and CEO, NPHCDA, Dr. Faisal.
Okay, yeah. Thank you very much for those questions. The first one was from Friday, from Channels, about how we're addressing the concern around the ability of the Federal Ministry of Health, NPHCDA, and the partnership to keep the vaccines at the right temperature. Well, first and foremost, what we have done is to prioritize a vaccine such as AstraZeneca that is stored at a temperature of +2 to +8 degrees Celsius. This is a temperature environment that we're very familiar with in our country. Most of the cold chain equipment that we have actually are compatible with that temperature range. Other vaccines that we're likely to get will also prioritize vaccines that we're able to store within +2 to +8 degrees Celsius. In transporting these vaccines from the national to the subnational level, we have reached an arrangement with CACOVID where they will use their cargo planes to transport the vaccines to all states that have functional airports. Those states that do not have functional airports will have their vaccines delivered to the nearest functional airport, and we will use our cold vans that have the capacity to maintain the relevant temperatures to move the vaccines from those nearby states to the designated states. So as of this point, we're not concerned about the potency of the vaccine as a result of the temperatures. The temperatures of our cold chain equipment are exactly what we needed them to be. I have mentioned in different fora that beyond the national level, the state level, the local government level, even in our political wards, we have been working with our donors, particularly Gavi, the Alliance for Vaccines and Immunizations, to deploy solar direct drives to all political wards in a way that will ensure that in every political ward we have at least one solar direct drive which uses solar energy. So even if there's no electricity, because they use solar energy, they're able to maintain the vaccines in the right temperature. These are cold chain equipment that we're already using for our routine immunization program. So it's not as if we're procuring just for COVID-19. 7,000, approximately 7,000 of about 9,000 political wards that we have already have these solar direct drives installed. Even as I speak, we're in the process of installing solar direct drives in the remaining 2,000 or so political wards. Our estimate is that we will complete this process by the end of 2021. In the meantime, any political ward that doesn't have a solar direct drive will liaise with neighboring wards and the local government areas. And we're working with the states and the local government areas. We have identified those health facilities, those wards without the solar direct drives, and we'll be able to get the vaccines to them. Some of the primary health centers, some of the political wards without the solar direct drive actually have general hospitals or teaching hospitals that have this equipment. So we're going to be working with the states, very closely with the states, to make sure that the cold chain equipment is maintained. One of the conditions for delivering vaccines to any state or local government is fulfilling some stringent criteria. If we're not satisfied with the storage capacity of any local government area, then we will not be sending any vaccines there. This is why we're doing another round of validating the capability of local government areas and states to store the vaccines. We don't want to deliver vaccines to the states, and because there's no electricity in the cold store, the vaccines are wasted. These are very expensive vaccines that come in high demand. So I want to assure you, Friday, that we're very cognizant of the fact that some of these vaccines in the portfolio require special conditions. This is why we're prioritizing the AstraZeneca and the Johnson & Johnson, which are kept between +2 to +8. We're also looking, the Honorable Minister is providing leadership in the conversations with the Russians. The DG of NAFDAC is also engaging with the Russians, including other vaccines. The Sputnik V vaccine is also another vaccine that we're looking at, and that requires +2 to +8. So those are the vaccines we're going to be prioritizing. You may be aware that even the Pfizer vaccine is now being adapted in a way that makes it possible to not be absolutely required that it is kept at -80 degrees Celsius. They've now applied to the United States Food and Drug Administration, providing evidence that it is possible to store this vaccine between -25 to -15 degrees Celsius. These are temperatures that we've kept our oral polio vaccines. So we also have, capability of storing those vaccines. But we'll wait until we have full information that those temperatures are compatible with the Pfizer vaccine. Again, we're working with NAFDAC to make sure that any vaccine that is approved to be used in Nigeria must be safe and effective. Kenneth Eze from Speak Out Africa Initiative asked about, the issue of exploitation. The Honorable Minister has answered that question. And then the plan to involve civil society organizations, absolutely necessary. Only a few days ago, we sent out a message to all states that because the COVID-19 vaccine is so valuable, no matter how much money you have, you can't have it on the open market. So we understand that people might want to play funny games with the vaccines. We have, communicated to the states that not only will government security agents be involved in keeping a close watch on the vaccines, but also civil society organizations need to be part of the accountability processes for those vaccines, so that those vaccines are not channeled to people who are not supposed to be prioritized. We have been very clear about who will be prioritized in this first tranche of the vaccines. So we're going to be involving the civil society, ICPC, EFCC, to make sure that these vaccines go to whom they are supposed to go to. I think the Honorable Minister also answered the question about adverse events following immunization. We're working together with NAFDAC. We're making sure that in every vaccination site, there's what we call an adverse event following immunization kit. So there are specific drugs that are kept at every vaccination site that makes it possible for health workers to respond immediately if there's any adverse reaction. But I also want to point out the fact that these adverse reactions are very rare. They are rare events. So let's not talk about them like, there are things that happen very regularly. I will, encourage you to even look at the types of adverse reactions that we have seen in the developed countries where these vaccines have been given. They are absolutely very, very rare. Okay? So thank you very much for those questions.
This is just to also just add that in cases where an application is made for vaccination in certain settings, let us say, for example, a critical industry where people are working, instead of the staff to leave and go and be taking vaccination somewhere, MPACD can deploy teams into those areas and vaccinate eligible people within those settings, industries, factories, refineries, so as not to disrupt work by people streaming out to go and get vaccinated, and to reduce large crowds and lineups in vaccinated vaccination designed areas, so that the points of administration will be increased, and then economic activity can go on. So that's a clear option for those who apply for attention for eligible Nigerians in certain closed settings. That includes prisons, for example, and other places where you need to deploy vaccination teams to come directly to come and meet you, so that your normal routine work is not disrupted by people leaving to go to get their vaccination. Just an addendum.
Thank you very much, sir. Honorable Minister, please permit me, the Director General NAFDAC would like to make one comment or two regarding the questions also asked. Professor Adeyeye.
Thank you very much. In terms of the maintenance of the cold chain, the maintenance of the quality of the vaccines, NAFDAC will from time to time pull samples out from the supply chain. We're going to start that process tomorrow when the vaccines arrive. We will check the vaccines in and then take samples. And from time to time, we'll be taking samples, just to be sure that the cold chain is not broken. In terms of adverse events, the Minister and Dr. Shaib had already said that they are rare, but because this is the first time that is going to be administered in our own country, Sub-Saharan Africa, we may get something, slightly different, but it's still going to be rare. However, whether it is rare or not, we're going to be taking exquisite recording. And NAFDAC is going to use Med Safety app. We are already teaching other healthcare workers. Med Safety app can be downloaded on a smartphone. You don't even have to be healthcare workers to download it. WHO kindly donated that or facilitated that for us last year, and the minister launched it. So we're going to be taking care of ourselves as a country, just to ensure that we are doing the safety monitoring very well. Thank you very much.
Thank you very much indeed, the Director General NAFDAC. The special guest of honor at these events, Honorable Minister of Health for the Republic of Nigeria, Dr. Sage Ehanire, the Executive Director, the Permanent Secretary, Federal Ministry of Health, ably represented here by Dr. Ngozi Azodo. Permit me to stand on the existing protocols as we invite the Permanent Secretary, Federal Ministry of Health, Dr. A.M. Abdullahi, to please come forward for his vote of thanks, and he'll be speaking through Dr. Ngozi Azodo, Director, Health, Planning, Research and Statistics, Federal Ministry of Health, as she gives the vote of thanks. Please let's give her a warm welcome with a resounding applause.
Thank you. Thank you for the invitation. Honorable Minister of Health, Honorable Minister of State for Health, Director from the Federal Ministry of Health, there are also participants online. Good morning, everyone. I think my job here is very simple, is to appreciate all of you, all of us, for all the work that has gone into this response, especially for all the work that has brought us here this morning. Especially all the work that has brought us this morning, which is the launch of T.E.A.C.H. While it is simple for this appreciation, when it has been such a huge enterprise that has involved so many partners, sometimes it becomes a challenge. But it is simple because we know who we have worked with and what everyone has done. So I want to first thank God. Thank God for the opportunity for us all to be part of making a difference through a very challenging season. and for empowering us to do that. I also want to thank the FOMH leadership under the Honorable Minister of Health, and then of course the management, which I want to single out the directors, especially Director of Family Health, who is here physically present, and then all the other directors that have worked to build the system and provide a policy guide on which our response has been situated. I have been personally touched by COVID. On the 11th of February this month, I lost my elder sister, due to complications, and I think that we must make the system work for us. So going forward, I want to thank the NCDC and their incredible crew for all the work that have gone on to keep the response and bring us to where we are. Since January 2020, and particularly February 27th, when we had the index case in Nigeria, they have gone above and beyond the call of duty to keep Nigeria safe. They have worked round the clock through uncharted paths and provided incredible leadership. So on behalf of the Federal Ministry of Health, I want to extend the appreciation of government to the Nigerian Center for Disease Control. NAFDAC has done a lot and has responded quickly to ensure that we are where we are today. The DG is personally present. Issuing an emergency use authorization is not an easy task. It's a long and excruciating process. And we work in very challenging environments. So we cannot take that for granted at all. So I want to appreciate the Director General of NAFDAC and her team for all the work that they have done. Like already stated, the work has just begun, because as Nigeria, the government is determined to take advantage of this pandemic to ensure that we begin to look at our local production opportunities. That cannot be possible if we do not strengthen NAFDAC. So NAFDAC, your work is cut out for you, and we are certain that you will rise to the occasion. The Executive Director, National Primary Healthcare Development Agency, Dr. Faisal, and his crew, he doesn't like it when I call him my little brother, so I'm not going to call him my little brother. Edie, you have done incredibly well, and I think you deserve a lot of accolade. So on behalf of the Federal Ministry of Health and the government, we give you that accolade this morning. We appreciate all the work that has gone into preparing for vaccination and vaccine access to Nigeria. It has been an incredible challenge, not just from within, but also externally, including internationally, with all the infodemics, the fake news, the vaccine hesitancy. But here we are today. So appreciating you cannot be too much. So we thank you, we acknowledge and appreciate all the work that has gone into bringing us here. We also thank you for your being proactive in ensuring that we are one step ahead of the things we need to do. So thank you, Dr. Faisal, my brother, and thank you to the NPA-CDA team. The frontline health workers have been an incredible access to government. And while it is difficult to name everyone, we do know who the frontline health workers are. So, for all the sacrifices you have made, for all the commitment, for all the hard work, for sometimes working with very little in very difficult environments, the government says thank you. We appreciate you. Thank you very much. I want to address the members of the Top Management Committee of the Federal Ministry of Health. The minister is the head of the TMC. I want to address the Minister of State and the Permanent Secretary and all the directors, including the chief executives of our ministries. As a team, they have done incredibly well. So we want to thank you, again, the directors who have worked hard to build a system. I know that In my personal capacity as the Director of Health Planning Research and Statistics, all these chief executives here have been on everyone's neck, looking at policies, looking at fact memos, making sure that everything is done and done in good time. We have worked very hard through very challenging times. So thank you very much. We have the National Council on Health, we have the National COVID-19 Coordinating Committee, we have the Ministerial Expert Advisory Committee, and all groups of people who have worked hard. But all this would not have been possible without the leadership of the Honorable Minister of Health. So can I respectfully ask that we stand up and appreciate the Minister of Health for his leadership, his political will to ensure that we are here where we are today. And I use this opportunity to say a few things about what the minister has done. When this when the epidemic first happened in China, the minister didn't waste. He didn't waste time, he didn't wait. He quickly mobilized the NCDC and the Port Health Services to begin to prepare and get Nigeria ready for this response. He also established the Interministerial Task Force on COVID-19, which had several ministries, the Ministry of Aviation, Ministry of Humanitarian Affairs, Ministry of Information and Culture, the NEMA, and of course NCDC and Port Health Services with WHO support and other partners working together to ensure that we provided the appropriate leadership. Thank you, Honorable Minister. At the declaration of a pandemic, the country naturally responded through the IHR 2005 by instituting a whole-of-government approach. In doing that, of course, the Honorable Minister continued to provide leadership as far as the health sector response is concerned. He developed the requisite plans, mobilized partners and mobilized resources, including mobilizing colleague government members of Federal Executive Council like the Federal Minister of Finance and all the other ministers that were important towards ensuring that we have an appropriate response. He also expanded existing strategies and continued to use this opportunity to strengthen the health system. Can we give the Honorable Minister of Health another round of applause? He has been assisted ably by the Minister of State and the Permanent Secretary. And of course, without the presidential support, that would not have been possible at all. In doing all of this, the Minister and the Ministry of Health continue to mobilize requisite partnerships. And so we want to thank our partners, WHO, UNICEF, Gavi, Novax, AVAX, and all the other partners who have been part of this response. Thank you very much for your support. As the ministry, we continue to count on your support going forward. We cannot end this appreciation without speaking to the press. This is one response that the media is so key to. And so we thank the media for helping us every step of the way. We can't list it all, but we've had the issues addressing vaccine hesitancy, the infodemics, the fake news, and all kinds of very unverified news. Thank you, everyone. It's finally, again, my pleasure to thank all of you for coming and to appreciate you for your support.